Good morning. It's me. A little bit late today. Oh well. But glad you could join me. Iced coffee today. Oh look, see, it's almond milk. Not sour milk, it's almond milk. Okay. So it gets a bit like, but it's iced coffee today. So that, because it's starting to get hot. So anyway. So today, it's not going to be, excuse me one moment, let me mute my microphone. Sorry, cock in my throat. Okay, now, today is a little bit serious. It's very hard to be light about this issue because it's something that affects me personally. It's something that has impacted my life, left me, in a pretty bad way. But it's just something that I think most people know about. I think if you're a woman, you'll understand, and if you're married to a woman, you'll probably understand this too. That the way that the medical profession has traditionally dealt with women, let's just say it hasn't been that clever, that good. Okay, let's just say that the medical profession has been very, very good at conducting experiments on women, okay? Or at least making a hypothesis using, all these sorts of things, right? So I'm just going to talk a little bit about the history of feminism, I suppose, and its relationship to medicine and psychiatry in light of the Johnson & Johnson vaginal mesh ruling that happened this week. So this is what I'm trying to do, which is take a story and wrap it up in a little bit of history and theory and perspective. Now, I've got a lot of personal experience in this because there's been several occasions where I have had my pain ignored, and if not for advocating for myself, I wouldn't be here. So this is something that is dear to my heart, and so let's maybe talk about it a bit. See how we go. Again, I'm a little bit the power went out last night. So everything was fucking chaos. So anyway, okay, so let me do a screen share. So this is from The Guardian. Okay, now I hate showing these things, so I'll just move to Pocket. Okay, now this will help frame this for you. Okay, so let me just turn off a preview window because it's annoying me, which is that Australian women win landmark vaginal mesh class action against Johnson & Johnson. Okay, now this is an article from The Guardian, which really summarises it pretty well. Now, for those that don't know, vaginal mesh is something that is used in varying degrees it's a medical device, right? I actually have mesh in my diaphragm, and because of a story that I'll tell you about later. So, okay, so for those that are listening, I'm reading out the article, or at least the highlighted bits. Getting better. So, hundreds of women left in debilitating pain by faulty transvaginal mesh devices have won a landmark case against multinational giant Johnson & Johnson. The Australian class action against companies owned by Johnson & Johnson, watched closely across the world, was initially launched on behalf of 700 women who had mesh and tape products implanted to treat pelvic prolapse or stress urinary incontinence, both common complications of childbirth. The devices all but ruined the lives of many. Women have been left in severe, debilitating and chronic pain, and often unable to have intercourse. The vast majority also suffered a significant psychological toll. The mesh eroded internally in many cases, has caused infections, multiple complications, and is near impossible to completely remove, Australia's federal court has heard. Okay, now, I'm skipping through because this is where this is going. So, the devices were not properly tested for safety before being allowed onto the Australian market. though Johnson & Johnson and the associated companies were said to have known the risks. The companies were accused of launching a tidal wave of aggressive promotion at doctors, marketing the devices as cheap, simple to insert, and a relatively risk-free way to boost profits. All the while, the risks were minimised, downplayed, or ignored, both in communications to doctors and patients. Oh, sorry, the tone of that was not right, so let me reread that sentence correctly. All the while, the risks were minimised, downplayed, or ignored, both in communications to doctors and patients, the plaintiffs alleged. I'm fucking up today. Sorry about that. When women complained of pain, they were frequently disbelieved. Skipping ahead again. The trial heard astonishing evidence about the multinationals' attempts to stop regulators raising concerns about the products. Internal documents suggested it tried to stop French health regulator, here we go, Haute Autorité de Santé, I don't know how to say that, from publishing a report warning against the use of untested pelvic mesh devices 2 years after the company began giving them to Australian women. Meeting minutes described in court showed Ethicon, how Orwellian is that name, a Johnson & Johnson company, feared the report, quote, could have major impact on our business if made public. It said work was needed to, quote, stop the publication of the report. Now, this is 2019, okay? Now, the reason that this is significant, right, is it's not a one-off, okay? Now, this one is particularly upsetting for me because I've had a very long and painful history with my health, and many of which could have been avoided if they'd actually listened to me, okay? Now, one thing that I know I've talked about this in the autism video, but I tend to be very clinical in the way that I explain symptoms because I do have that slight disconnect from my body. I can explain it in clinical terms, right? So if I present, say, to the emergency department, I will go in and say, okay, I have chest pain, I have this is bad, you know, blah, blah, blah. I look weller than I am because I have that sort of, that I don't show the physical. So to their credit, that's me, right? That said, I've had my, like, constantly not listened to, and almost died 3 times as a result, okay? So I just want to point this out. This is something that I just want to talk about because it's also something that you need to understand that medicine is still experimental, okay? There's a massive, massive imperative for, I hate saying big pharma, but big pharma, right? When you need to think about this stuff, okay? Now, the significant thing about this article is that not only did they knowingly insert untested surgical devices in women, right, that cause them a lifetime of pain, distress, and all of those things, right? When it came to light that they were faulty, guess what? They tried to suppress it, information, okay? And then they actually went to court rather than settling this, okay? And that just shows the lengths that pharmaceutical companies like Johnson & Johnson, Procter & Gamble, those sorts of places, they're not our friends, okay? Now, there's a big shadow hanging over women particularly, and also there's, you know, people with mental illness and those sorts of things as well, but I'm focused on women. Don't what about me? I'm focused on women, okay? The history around this stuff is that women have been largely dismissed, right? Experimented on, right? And ironically, here's a fun thing, right? Hippocrates, right? First, do no harm, the god of medicine, right? The grandfather of medicine. He was the one who came up with, you know, the idea, the concept of the wandering womb, which I'll introduce you to after. Okay, so this one, where's the other article? Okay, so this was in Marie Claire. Okay, so it's obviously an opinion piece, but it was actually a pretty decent piece. And there's a massive gap, right? When you look at the data, okay, especially around women's heart attacks, around listening to women's pain, right? Usually they need multiple visits in order to be taken seriously, or they need to be in a more severe life-threatening state before they get treatment, before, like, the delayed diagnosis with cancers, okay? There's all of these things. There is a problem, okay? There's a gap. And this article really sums it up. So I want to talk to you about the gender pain gap. Again, most women who've lived for more than 5 minutes will understand this. Okay, this one is about endometriosis in particular. But, and don't fucking what about the men meat? Okay? Yes, prostate, whatever. It's because you're afraid to have a finger up the bum. It's a different fucking problem. All right? Anyway. I'm not dismissing male problems. I'm just saying, don't fucking come at me with the what about bullshit. I'm talking about women. It's not about you. How about you listen and learn, okay? All right. I love you boys. I'm fucking with you. Okay. So Kylie Maslin spent 14 years trying to find an answer for the excruciating, debilitating pain that accompanied her period each month. From the age of 13 to 27, she knew something was wrong. I actually have gone through a similar thing, okay, where I had 20 years of health problems that didn't actually culminate in any diagnosis until I was in my 30s, okay, late 30s, despite having severe life-threatening problems. And also, I've just been dismissed my whole life. And if you're a woman and you're overweight as well, fuck. Like, I've been overweight most of my adult life, and I used to joke that if I turned up to the emergency room with an axe in my head, they'd say, have you tried paleo? Like, I'm not kidding. Like, this is just fucking, you don't get hurt, right? And as a result, preventable, easily treatable conditions, easily detectable conditions, if someone would actually listen, would have been actually made a lot easier to live with in the long term, and I wouldn't be living with chronic pain now. Okay, so anyway, I'm fucking pissed. Anyway, I can't even sue. Anyway, so this one, endometriosis, right? Stop dismissing women's pain, okay? So let's just keep going through. I'm not going to keep, let's move into the, so this is talking about endometriosis, right? So The Girl Who Cried Pain was a seminal study published in 2001, which definitively detailed how doctors and other medical professionals responded differently to women compared with men. Quote, women are more likely to seek treatment for chronic pain, but are also more likely to be inadequately treated by healthcare providers who, at least initially, discount women's verbal pain reports, wrote Professor Diane Hoffman and Professor Anita Tarzian from the University of Maryland in the United States. Quote, they attribute more import to biological pain contributors than emotional or psychological pain contributors. Okay. Now, there's a legacy with this, right? And also, because I can speak to this myself, which is the fact that I can intellectually describe my pain very accurately, right? That's something that, again, being on the spectrum, I'm used to having to do. But I may not give the markers of severe pain. Okay, so when someone else's 10 sort of presents as like a 5 or 6 on my face, right? And I get that medicine has to have some clinical observation, but a lot of this is that people just don't listen to women when they speak, all right? Which is that this is extreme pain, is what I would say, and they'd look at me and go, well, you don't look like you're in pain, right? Apparently I also don't look like I'm autistic, and I don't look like I'm celiac, and I don't look like I fucking all these things. So it's not a fucking, anyway, whatever. So, point being, women, like Paul, right? goes to the hospital for chest pain, he's seen straight away, right? We've had this experience. It took me, so this is what happened to me last year, which has left me sort of a bit still rebuilding my life, which is that I had my gallbladder out back in 2002 after my daughter was born, and I presented to the ED with Saturday morning. I've been having chronic pain in my stomach for many years, and I have had other problems, so I won't talk about those. But so I presented to the ED. I said, look, I've got this history, this history, this history. Okay, I needed fentanyl, right, to fucking even be able to speak. But by the time I got into the emergency room, again, I was on fentanyl. I don't get kooky from opiates, so I just look like I'm fine. But they took bloods, and I had and they said, you're fine, go home. I don't see any problem. Okay, then. I said, well, no, actually, I wouldn't be here on a Saturday afternoon. I've got shit to do. So they sent me home with my bloods, right? My bloods showed elevated liver problems, okay? 2 days later, I was back in the emergency room. Ambulance costs $1,000 a trip, by the way, just so you know. Same thing. Second visit, same thing. Strap me to a heart monitor, give me like pain relief, send me home. Okay? Yeah. Day 3, I go back again. Same thing, but worse. This time, I was sent with my bloods, liver enzymes on the increase, right? Fucked. Day 3, back at the emergency room, okay? Sent home. I then go, this is not okay. We go to the private hospital. Actually, no, we went to the public hospital. Then they said, they looked at me. I was at that point yellow in the eyes and the face. My liver was failing. I was yellow. I was in extreme pain. I was extremely sick. And at the ED, they said, sit over there. There's a 4-hour wait. So we went, fuck this, and we went to the private emergency room. At which point, within an hour, I was diagnosed with a bile duct obstruction, recurring stone, which, apparently is common. No, it's rare, but it's not unheard of. Nobody bothered, right? It could have been picked up by an ultrasound. Cheap, easy to pick up. Okay. At that point, I got a bile duct perforation. Oh, sorry, hang on. No, I'm wrong. It was a big stone in the bile duct. I was, taken I had to have a procedure. At that point, I was so sick that not only did my bile duct perforate, but I had a something else. I can't remember, but it was a mess. Basically, it was mush, right? I had pancreatitis, right? And it was acute and severe and the most extraordinary painful thing in my life. This is only a year ago. And I had spent 10 days in hospital, and it probably should have been more, but I insisted on coming home, right? Now, this was life-threatening. I was told by those doctors that if I had waited another 24 hours, my liver would have shut down, that I was very, very sick, and that if I had been ignored or they had missed it, I got the why didn't you come earlier conversation, and I said, well, I tried, okay? This is the reality of living life with pain, especially abdominal pain, as a woman, right? Especially as a fat woman, right? So you turn up, well, I'm not as fat as I used to be, but, I'm not thin, right? So you turn up and they go, well, it's not a heart attack, off you go. And it's like, well, okay, fine. So this is just one experience that I've had, just one, where I have, and that is the most recent one, okay, where I have done the right thing. I've done everything right. I've communicated clearly. I've shown all clinical signs. My blood results were showing that I was heading towards liver failure. Like, it's just insane, right? I'm just thankful every day that I pushed and I refused to take no for an answer, and we went to that private hospital, because I would have been in a state, by the time I'd gone back, I would have been in such a state that, I might not be here, okay? So, and that's just one, all right? I walked around with a diverticulum, like a scarring, complete, because I had a surgery that perforated my stomach and had a lung collapse back in 2007, right? And I walked around for 10 years, 12 years after that, with a giant scar crater in my stomach and a atrophy and scarring in my diaphragm, which then needed to be completely resected, and therefore, I have no stomach, right? Well, that's not part of that's another story, but it's yeah. So basically, 12 years of gastritis attacks, extreme stomach pain, reflux, pain when I sneeze, all of these things, talking about them constantly, bringing them up, right? Having to deal. And it was only when I had a pre-op, what's it called? Fucking the endoscopy. Again, a simple, cheap test, that could have saved me 10 years of pain in my life, okay? No one listened, right? I had a giant crater in my stomach. So that's another thing leading to me losing my stomach and gaining weight and all sorts of endocrine dysfunction that comes with a dysfunctional stomach, okay? Celiac disease. Didn't get diagnosed with that until I was 38, okay? It keeps going. So that's my story. I know I've wandered off on my story, but anyway, let's move on. So the reason why this is really resonating with me is because Paul goes to the emergency room, says, I've got chest pain, and they go, yes, sir, and he's admitted. It's amazing the contrast and the experiences between me and my husband, who both have different problems, right? So anyway, So meanwhile, a study published in the US National Library of Medicine revealed that women wait on average 65 minutes before receiving an analgesic for acute abdominal pain, compared with a wait time of 49 minutes for men. Okay, now that's, again, an average, so I would guess that there are women who wait a lot longer, okay, and get ignored altogether. So, quote, the gender pain gap is absolutely a problem and is one that we do need to address. Reconstructive surgeon Jill Tomlinson says, medicine is a fairly patriarchal profession, and while that has changed in recent decades, even people who are coming through today have expectations of gendered behaviour. Yeah. Okay. Now, women are also disproportionately told that their pain is, quote, all in their head, that they are suffering from anxiety and depression, the thing that I've been told all my life, right? Or even that they're simply making it up. Okay. Professor Louise Sharp, an expert in psychology at the University of Sydney, who has researched this subject extensively, says that women are more likely to be given sedatives, medicine for anxiety, depression, or referred to a psychologist than actual pain relief. And that's been my experience too, right? Chronic pain, get an SSRI, right? Chronic pain, Valium, right? In hospital, in pain, they give you lower doses of everything, even though you're in extreme pain, okay? You have to really, if there's one thing, advice that I can give as a frequent flyer in the hospital system, is to advocate for yourself and just push. Don't be afraid to be that patient that's difficult, okay? Like, it can be a life or death thing. Make sure you know what your tablets look like. That's another one, okay? Trust me, I've been given the wrong medication and gone, that's not my medication. I've made them check. I've made them go back, right? Is that bubble in my IV okay? Those sorts of things. You really, really need to stay on this, okay? And it's unfortunate that we have to, but we have to, especially as women, okay? Now, They don't really like me in the hospital because I don't take shit. Okay. So I'm not letting those fuckers kill me. If I die, I'm going to like do it flying off a mountain, not in a fucking hospital. All right. So, and quote, anything that's related to the female reproductive system too is much more likely to be seen as psychological rather than physically oriented. This has a terrible effect on women and can cause a much more protracted outcome. They often go away and feel much worse about themselves, and they worry that they have to convince their doctor that they really are in pain. Now, I want to talk about, well, I won't talk about my first child and the childbirth, but I will talk about my third child, okay? I had a history of preeclampsia, shock, horror, surprise, because I win the lottery and everything, right? And it's unusual for you to get preeclampsia a second time, let alone a third time. However, I did. My blood pressure went through the roof and it was just unstable, right? Now, so I was under watch, but I was with a private obstetrician, and he just didn't believe that I could, like, that I was a high-risk pregnancy, which I was, right? I was told by the public hospital that I should, you know, that I was high risk, that I shouldn't be taking, you know, when I was first pregnant, my GP said, you're crazy, right? This obstetrician, for some reason, just saw me as a fucking cash cow, right? Absolutely disgraceful. And because one thing in Australia, obstetrics, you need to pretty much book in with the obstetrician before you get pregnant. Otherwise, your choices are limited. There's waiting lists, right? You can't, it's very, very hard to get the good ones. So I just went with the only private obstetrician that I could get. Now, at 33, so I was already nervous about pregnancy. I was already anxious, you know, like, because I'd already had a history of high-risk pregnancies and that sort of stuff, right? And at about 33 weeks, the baby stopped moving, like, as much as he was. And so I kept telling him, like, the baby's not moving, okay? He's not moving. Like, it's just, there's something wrong. And if you've ever been pregnant, you know, right? You know when you're pregnant, and you know when something's not right. There's something instinctive about being, that there's something there, right? There's a bond that it's really hard to explain unless you've been pregnant. When something goes wrong, you know it in your bones that something is wrong, okay? Now, as an obstetrician, he should know this, right? And my blood pressure went through the roof, like 220 over, like, can't remember, 110 or something like that, ridiculous. And I was, again, same thing that's always happened in every other pregnancy. He wouldn't listen. The baby wasn't moving, like kicking as much, right? He wasn't moving around. This was at 33 and a half weeks, right? He admitted me into hospital for my blood pressure, got my blood pressure down, but wasn't really monitoring the baby, okay? He was just doing a heartbeat check every so often, right? Private hospital again. Anyway. And I just had this feeling. I was like, I can't, no, this isn't right. He's not kicking. He's not moving. And they do that test where they give you the lemonade or the orange juice, and then the baby moves and they go, yeah, okay, right? My blood pressure was stabilized, and they did the glucose test. That was it. Didn't do anything. No ultrasound, no easy basic test to make me feel better or to make me think, okay, everything's okay. Nah. Right? Nobody trusts the mother's instincts, right? Nobody trusts the woman's instincts, right? And so I refused. I just was upset because I knew that there was something wrong, and I was upset and distressed, and I discharged him and I sacked him, and I demanded that he refer me to the public hospital because I wanted to go there for monitoring because my previous pregnancies had been monitored. Now, I got there for monitoring. They gave me an ultrasound, and it turned out that my baby had severe growth restriction and he needed to come out the next day. And so with this history, right, and I know I'm just talking about me, but this is just something that happens to everyone, and it's happened to me so many times. It's fucking exhausting. And this vaginal mesh story, settlement, good on it. Good on those ladies. I know that money doesn't buy, you know, a cure or anything, but at the same time, like, this is fabulous, right? I've never sued over these things because it's just, you know, it's just not worth it. So if I was in America, I'd be fucking loaded from all the lawsuits. In Australia, it's a lot harder. So one study revealed that women are 7 times more likely than men to be misdiagnosed and discharged during a heart attack, right? Female heart attack symptoms are different, okay? So again, have a read of the article. I won't read through the whole thing because of time, but it's very important to be aware of this as a woman. You need to, it shouldn't be on us. The burden shouldn't be on us. The onus shouldn't be on us to speak up and make demands and be that difficult patient. But sometimes we need to be to survive, right? Much like every other part of life, we shouldn't have to protect ourselves from violence. We shouldn't have to make provisions. We shouldn't have to nag. We shouldn't have to make demands or go on strike. But that's shouty women get shit done, okay? It's just how it is. So one thing, if I have any advice for younger women out there, don't be afraid to assert yourself, and that's just part of being a woman, okay? Don't complain about having to assert yourself, okay? Men out there, listen to what women are saying to you so they don't get to a point where they are screaming and yelling and striking and dying, okay? Women know, there's a common theme here, women know things too, okay? And women know things different or better in some cases, like our own bodies, okay? So just a bit of advice for everybody watching, listen to other people, okay? Okay. Doctors, if you're listening, I doubt it because you don't have fucking time for my whinging, but fuck, get your shit together. Anyway, so the gendered notion, and this is what I'll get to, and I just for the sake, this is in Marie Claire, so they're going to use gender incorrectly. I'm just reading out the article. So to quote the article, the gendered notion of women's pain has a long history, right? And that's what I'll get to. In the 19th century, women were routinely diagnosed with, quote, hysteria, instead of having genuine medical issues seriously assessed. A hysterical woman was deemed to be mentally unwell, in part because of her natural womanly weakness. Okay? Okay? Now, this is, again, I'm going to digress, but I've been seeing this a lot lately, and the fucking bros turning around going, feminists are the ones that said that there's no difference between men and women. No. What we're saying is there are biological differences. We're talking about this shit, okay? Natural womanly weakness and the way that that has been used to abuse us, okay? We're not talking about denial of science, okay? We're talking about this, the legacy of hysteria, the legacy of basically of wandering womb, which we'll get to, okay? The legacy of women having forced hysterectomies, being locked up in mental institutions, right, for being assertive, okay? And it hasn't changed, it's just different. Now you just give her fucking death threats and gaslight her and tell her that she's fucking, tell her that how she's wrong on YouTube comments. So no need to talk like that, dear. That's the thing that men don't seem to understand, is the legacy of this stuff. There has never been any denial that men and women are different, okay? There has never been a serious feminist, okay, or serious fucking person that has said that there are no biological differences between men and women, okay? What we're talking about is that because of our different biology, okay, we get natural womanly weakness, okay? That's what we're talking about. It's about the way we've been treated based on the fact that we have uterus and vagina and boobies, okay? And that's that's part of the reason why this fucking gender debate is bullshit, okay? Because women have this history that men will never understand, okay? Never understand it, ever. So, that was a digression. Anyway, so Hysteria comes from the word uterus. Let's talk about hysteria. I won't spend too much time, right? But female hysteria was once a common medical diagnosis for women, which was described as exhibiting a wide array of symptoms, including anxiety, shortness of breath, fainting, nervousness, sexual desire, insomnia, fluid retention, heaviness in the abdomen, irritability, loss of appetite for food or sex, sexual desire, you have hysteria. If you don't want sex, you have hysteria. You need to have the right amount of sex as deemed by men, just the right amount. That's the tightrope that women constantly walk, right? Damned if you do, damned if you don't, right? Sexually forward behavior and a tendency to cause trouble for others. Fuck, I'd be fucked. It is no longer recognised by medical authorities as a medical disorder. Its diagnosis and treatment were routine for hundreds of years in Western Europe. So this is the fucking history. You can't deny history. You can't keep talking about how things are equal now when this has been something that is within the foundations of the medical system, and women keep being ignored and keep dying and keep being experimented on. Okay? Now, so I won't go into this. Read it if you're interested, right? But Freud, right? That fucker, right? So female hysteria sharply declined in the 20th century. The decline has been attributed to many factors. Some medical authors claim that the decline was due to gaining a greater understanding of the psychology behind conversion disorders such as hysteria, right? Where was it? So Sigmund Freud claimed that hysteria was not anything physical at all, but an emotional, internal affliction that could affect both males and females, which was caused by previous trauma that led to the afflicted being unable to enjoy sex in the normal way. This would later lead to Freud's development of the Oedipus complex, which connotes femininity as a failure or lack of masculinity. This stuff is the building blocks for medicine and for psychiatry. This thinking, this bias, okay? Now, Hippocrates, okay, came up with the concept of wandering womb since ancient Greece, right? Wandering womb was the belief that a displaced uterus was the cause of many medical pathologies in women. The belief originates in the texts of ancient Greece, although it persisted in European academic medicine and popular thought for centuries. Okay, and again, I know we're talking about 300 years, but this stuff, like the history, again, there was a time when I actually started to go to medical school, so I know a lot of medical history as well as the other stuff, and this is the stuff that actually was just, right? And I looked at what was interesting here. If you look at this Wikipedia article, when you go to the opposing views, I was like, oh, was there an opposing view? Oh, good, feminists. No, let's look at the opposing view, shall we? Soranus, I think, of Ephesus, fucking Greek, another 2nd century AD physician, opposed the theory of the wandering womb. In a description of what he labelled hysterical suffocation arising in the uterus, Soranus wrote, "The uterus does not issue forth like a wild animal from the lair, delighted by fragrant odours and fleeing bad odours. Rather, it is drawn together because of stricture caused by inflammation." Right? Again, I know that's ancient Greece, but again, it's just the fact that sorry, I just knocked over my mic. I got animated. Sorry about that terrible noise. So where Aretius used the more neutral living thing, Soranus used the term for wild beast, therion. Okay, these are the opposing views. Nobody said, oh, maybe they're not crazy. Maybe they're sick. Men get sick, women go crazy, right? That's all you need to know for history. So anyway, so the hysterical suffocation, wandering womb, that's the foundation of medicine, okay? Again, very interesting. So, I'm going to get to this one. knowing what we know about autism, being missed in girls, hysteria, wandering womb, forced hysterectomies for those who are feeling, you know, depressed or anxious, okay? It's time to talk about rapid onset gender dysphoria and how this is an experiment that is happening and that this is a disaster waiting to happen. This is the new vaginal mesh fucking class action. Okay? I'm not going to read all this article because this is actually an older article, but what's important here is that, where are we? So Lisa Littman, right, an assistant professor of behavioural and social sciences at Brown University, was curious about what was causing these changes. She had come across reports from parents on online forums describing a new pattern of behaviour. Adolescents without a history of childhood gender dysphoria were announcing that they were transgender after a period of immersing themselves in niche websites or after similar announcements from friends, right? I've observed the same thing. Her study suggests that these children may be grappling with what she calls rapid onset gender dysphoria, okay? Now, this was a study, Dr. Littman, Brown University, okay? Guess what? Controversial paper. Guess what? Brown took it down. Guess what? They're trying to suppress fucking research on these things, okay? Now, is your heart in your tummy yet? Thought we were going to talk about lady bits, didn't you? So, following a review, so basically this study came out, the rapid onset gender dysphoria study, and TRAs got outraged, tried to shut it down, and it got shut down. It was removed from the Brown University website. Journal issues revised version of a controversial paper that questioned why some teens identify as transgender. Okay? It just questioned it. It was a paper. It was research. Now, the suppression of research is something I've talked about before. You cannot research this stuff. They are getting outraged and blocking all research, right? They're hiding studies that show long-term impacts of puberty blockers, right? They're doing this. And you know why? Because there's money in it. Johnson & Johnson, Procter & Gamble, doctors who don't have a very good history. Okay? Guess what? Hundreds of thousands of dollars in surgery and you've got a patient for life. Why would you not? Why would you not suppress? Why would you not put something out in the market that was not properly tested or researched for safety before being put on the market? Okay? Why would they not launch a tidal wave of aggressive promotion at doctors? Marketing the devices, binders, hormones, puberty blockers, as cheap and relatively risk-free way to boost profits. Yeah, relatively risk-free, right? Because that's what they keep saying at TAVRs. That's what they keep telling kids when that's not the case. They call it a pause button on puberty, which isn't the case. You're forever stunted in your growth, right? And most people who go on puberty blockers have to go on hormones on some level, right? The trial heard, I'm going to go back. The trial heard astonishing evidence about the multinationals' attempts to stop regulators raising concerns about the products. Suppression. So who's behind this stuff? Internal documents suggested it tried to stop the French health regulator from publishing a report warning against the use of the untested pelvic mesh devices. Okay. Guess what? There's a journal article here, chest reconstruction and chest dysphoria in transmasculine minors and young adults. Okay, guess what? This study is pro. It says that all of them are happy. Okay, again, I'm not saying that it's not the case, I'm just saying in this study. But what I want to show you is this. Post-surgical patients. 2 of them, 13 years old. 5 of them, 14 years old. 9 of them, 15 years old, having full mastectomies. Okay? 9 of them, 16 years old. 8, 17 years old. Okay? 18, right? And what's interesting about this graph is if you know child development and adolescent development, you'll see that, again, I'm not sure what the numbers were there, but in your 20s, you generally, a lot of these feelings decrease. So I'm not, just that graph, I'd have to look at that. That's not really reliable, but this is stuff that you need to know is going on. Okay? All right. I'll link to this. Now, this study says that they were overwhelmingly positive, right? They don't regret it. They ask them, they check on them and say, oh, did you post-surgical? Are you happy that you've had a mastectomy? Okay. And guess what? They all said yes, because they're post-surgical. Okay. It's not lifelong. But again, one thing we know to be true is that even breast cancer patients, they may misjudge how they'll feel after mastectomy. Okay. And this is for adults. Right. And having gone through several surgeries myself, having gone through various things that are major life changes, is that you just have no idea how you're going to feel. You can't predict the future. You can't predict how things are going to go. As a result of all that stuff that I talked about before, I now have permanent damage to my pancreas, my stomach, my diaphragm, and I live with chronic pancreatitis plus celiac disease. It's really fun. Okay, so this is the thing, right? But that chronic pancreatitis, that was avoidable, right? The lack of stomach was avoidable, and the diaphragm, avoidable. Okay, thankfully all my children are healthy because I would not, I mama bared on the doctors, but I'm just saying, this is what's going on, right? Women with vaginal meshes being experimented on because they want a solution, and they're not given accurate and clear advice about, there's no informed consent, right? They hand you a paper and go sign here, right? And this is another thing with when I had the ERCP, I was so out of it and they just went, oh, well, it's just like an endoscopy. I didn't realize that it was actually a high risk procedure because they conceal the risks, because they rely on you. You know, like this is something that people need to understand, is that you can't trust your doctors as much as, again, doctors are just human. They're part of a system. It's not the individual, it's the system, right? But this is a nightmare. This is the next vaginal mesh, right? Get girls as young as 13 who are autistic, probably, going through ordinary teenage girl shit, which is, you know, another thing. You know, it's normal for teenage girls to hate everything and not know who they are, and, you know, think that there's something wrong with them because a boy doesn't like them back, and then want to change their body, and, you know, all that stuff, body dysmorphia, all those things, right? And they're giving 13-year-old girls binders, puberty blockers, and mastectomies. And there's publishing studies that support it, whilst suppressing those that question it. Okay? This is what's happening, and I hope that people are aware. Okay? Don't trust your doctors. They're human. They don't know everything, right? I had 4 doctors miss my gallstone, okay, and miss my pancreatitis, okay. I had them, you know, I've gone through so many procedures, and I have had to. The doctors are human and they are fallible, okay, and you need to take it upon yourself to make sure that if you're a parent of an autistic kid, just please read this stuff. Please understand what's going on. Now, I know that this looks a bit like cherry picking. I know that there's lots of other research, but the point is that Johnson & Johnson have shown that they are suppressing research on that shows things that affect their bottom line. Okay? Now, I know to be true, that trans rights activists in particular are pushing for I don't know who's funding them, but they're clearly well resourced. I've said this before. There's a machine behind that, and it's just crazy, right? But this is, it's just wrong. There's a generation of girls that are just, and there's no skin in the game for the surgeons, because if they change their minds, they can just sell them a reconstruction and make more money, right? They don't care about us, right? The medical profession doesn't care about women. The medical profession sees us as lab rats, okay? Or an inconvenience, or just another patient, or just another body, okay? We're basically cadavers, all right? Please look after yourself, look after your children, and I hope that this has been of value. Thank you for watching if you're there. I love you, and I will see you tomorrow. I'm sorry this wasn't funny, but you see how mad I get. All right. Bye.